Before I started GP training, I was a UK medical graduate, so I did foundation training. I did F1 and F2 with sort of, very big mix of rotations. I thought about taking an F3, but actually because of COVID, I sort of decided that my F3 plans were probably going to be curtailed, so I just decided that GP was what I thought I wanted to do, so I just went straight into that.
So, unlike Tom here, I'm actually an international medical graduate, and I wasn't clear on what I needed to do. So basically, I came here, worked as a locum for about a year, then moved on into oncology as a clinical fellow for about 2.5 years. And then at some point, I decided I need to be in a training program, and that's when I applied for GP training and also for CMT. But eventually got into GP training and enjoying it so far. So yeah, that's my background.
I was trained in India for my medical school, and immediately after medical school, I was trained in orthopedics for nearly 6 years. So 4 years of that was in India, and I came to UK and worked in orthopedics again for 2 years. Slowly started losing interest, and then I decided to move to GP, and I started GP training.
Having not worked in a GP practice as a doctor, having done a medical school placement, but having never actually done it, and then having done a couple of years of hospital medicine, definitely one of my biggest fears was, I'm going to go from this busy ward environment where there's constantly nurses, doctors, physios, all these people around where you can always get advice, there's daily meetings. Am I going to feel isolated? Am I going to miss that kind of, that team environment? I very much felt like I was going to be sort of isolated in my room. But actually, I was definitely, having started my first GP job, I definitely was quickly reassured, actually, that's not the case. It obviously will depend on the size of the practice, but there's always going to be people around. There's always going to be your supervisor or another GP. If you're not sure or you want sort of advice in the moment, you can grab them, or after your clinic you can debrief with them. There'll be weekly practice meetings. You can discuss patients you're not sure of that don't need an urgent discussion. So there's pharmacists, there's social prescribers, there's always people that you're going to for advice, or they're coming to you for advice. So that fear actually was quite quickly sort of dissolved. I think there's always a really nice team environment, even though you're not maybe doing it in such a sort of ward round, all going together, but there's very much that team feeling. Yeah. What about you?
So the biggest fear for me was basically that when I started working here in the UK, my main thing was that I had no idea how the community setting worked. So when I was moving into the GP practice after having done 3.5 years in hospital settings, I had no idea what I was looking for. So my biggest fear was not knowing what am I going into, what kind of patients I would have, who would I be seeing. But basically, I realized eventually that you just dive in head first and then see how it goes, and then always ask for help for people around you, and that just makes things easier. So if you don't know anything, learn about it. That's the easiest way, and that just makes things easier. But yeah, learning about the community settings, I'm in my second half of the ST2, and even now, community orientation from the get-go has been on the top of my list for my PDPs. So that's something that I've worked on, and I think I'm actually a lot more comfortable now. But it was something that I really feared to begin with. But facing your fears is basically, I think, where we are in the GP practice.
Main reason I joined GP was to have that continuity of care and seeing patients through their illness, like from beginning to end. But that came with the fear of transforming myself into very micro-specialized surgeon to a generalist. So my main fear was, how am I going to deal with that, everything I don't know. So when I came for the induction, one of the program directors told me that every third case we see in GP is musculoskeletal. So that totally put me at ease. Then I took that as my strong point, started seeing MSK cases, which made me felt very comfortable. And when I had to see other cases like dermatology or gynecology or something from ENT, I used to have a good 5-minute read about what I'm going to see, and that totally put me at ease. So now 1 year into GP training, I learned so many things, and that fears have definitely improved.
I think there's something in there about like the the fear of unknown in
Yeah.
all of our scenarios. But I think it's always sort of good to
Yes.
get into it and then take it one day at a time and
Yeah.
see how things go.
Yeah.
Another thing that I would say, which kind of links into what you were saying about the fear of, what if I don't know what the diagnosis is? What if I don't know how to reassure the patient? So I think that's a fear that probably carries on throughout. Yeah, that will
life.
continue. That's something you're constantly working on. Even I'm sure kind of experienced GPs have that. I have no clue how to deal with. Well, I don't know what this thing is. What am I going to do? But so sort of learning that most of the time, when you're seeing a patient, you don't have to know the answer in the moment. You don't have to know the answer. Even you have time. You can ask for advice from your colleagues. You can ask for advice from the hospital specialists. You can refer on. You can go away and do some reading and come back to the patient and follow them up the next week or the next day. So there's the nice thing about general practice is that most of the time you're not dealing with emergency scenarios.
Yeah.
Most of the time that you have the ability to say, I don't know what's going on. We'll do some initial investigations. Let me see you next week, and you have some time to then go away and sort of do some thinking about what might be happening. So that's another fear that I think has been sort of allayed during my time.
After working 10 years in hospital, at times it was quite taxing and too much strain on ourselves. And after working 1 year in GP, I can honestly say I'm definitely enjoying it, because I can predict what my week is going to be, and I can actually have some time for myself and family, and there is the continuity with the patients, and when you deal with the patient from beginning to end, you get that satisfaction. So I'm definitely enjoying it, and I'm sure I'll continue enjoying it for the next so many years.
You enjoy being a human now.
Yes.
Yeah. But yeah, I completely agree with that as well.
Yeah.
I think lifestyle is one of the biggest factors. But I think for me, what's happened is that my fear of actually coming in and not knowing the community setting has actually become my sort of satisfaction in being a GP, knowing the community, knowing the framework, getting to carry on with these people, having that continuity, having that interpersonal relationship with these patients. I'm actually enjoying that now, and I think that's what's the good thing about being in the GP practice for me.